I keep saying it, I repeat myself a lot, but I keep saying it on radio, this is one of the many projects, and before Aina already introduced this with Dr. Quintana, but she explained all the R plus D projects, but there is one that I like especially. I mean, I like them all, but Preventomics, I don't know why I like it especially. And we're going to talk about it. We're going to be talking about tailor-made feeding for athletes, and we're going to welcome Dr. Biotza Gutiérrez, Programs Project Manager in EURECAT. So where do we have? Okay, yes. So please, a big round, a big hand to get some energy. Please don't run, Doctor, because we'll say hello to Dr. Josep Maria Albas. He's responsible for nutrition and health. Welcome both. A big hand to the two. As I was saying, this is an international project which I'm personally passionate about. I do believe both of you have presentations. We'll be starting with Dr. Albas, and our colleague Christina is going to be helping out. Please do sit down, Doctor, in the meantime, and that way we'll enjoy the first presentation. Later on, we'll enjoy yours. And let's see where omics are. Go ahead, please. Well, thank you very much indeed. Thank you to the Olympic Committee, to the Atlético de Madrid Foundation, OAFI, for having invited us to talk about the Preventomics project. We are really very eager and happy about it, those of us participating, and it is actually getting to completion phase. So we are already seeing some of the very first results obtained as regards this personalized or tailor-made nutrition program. Let me go ahead with the slides. Yes. Okay, I was holding the device the wrong way around. Anyway, when we talk about personalized nutrition, we essentially talk about recommendations about dietary behavior appropriate for an individual to maintain an optimal health status. And in order for these recommendations to be given, different traits of the individual have to be taken into account: the diet, style of life, preferences, but also the phenotypal status. When we talk about the phenotype, we mean all the physical traits of the individual. And we also refer to the genetic status of that individual, to the genetic background. That is, what kind or what gene variants do we carry that make us susceptible to some diseases or susceptible to respond in a certain way to some nutrients in the diet. So on the basis of this, we can in fact give dietary recommendations as to what elements of the diet we can choose, what are the most adequate diet patterns for us, or even lifestyles that we can adopt to improve our nutrition and our health with this relationship. Typically, when we talk about personalized nutrition nowadays, people talk about genetics a lot. There are many services where they carry out intense genetic analysis, and these analyses make it possible to determine what might be the pathologies that we may develop in the future, and most especially in the case of nutrition, how can we actually get to respond or react to certain nutrients. What is very clear is that genes are not everything. We see it in studies and research done with identical twins. These are genetically identical, as we know, but because of the different lifestyles, because they have developed in different surroundings, they develop different phenotypes. We have pairs of twins in which one keeps a good state of health, no obesity, whereas the other goes towards full-blown obesity. These cases are really very interesting to study because in this way we can see what the environmental factors are that most contribute to these differences, proving that it's not only the gene pool of a person that determines what we eventually are, but it's also lifestyles that determine how we are and what we are at the end of the day. Then how can we determine or assess this phenotypal status? How can we define the physical traits that will help us personalize diet and other treatments? Well, here we can mention the body mass index, this has to do with weight, then the composition, that is the amount of muscle mass that we have, fatty mass, some clinical aspects. We can talk about glucose, cholesterol levels, and other measurements that allow us to go towards personalized recommendations. However, these measurements don't allow us to determine exactly how our metabolism is working. And essentially, of course, our metabolism is what determines our state of health. We see it in some publications, such as this article. Have a look. Here we have mortality increasing in a population. This was studied in the article. You see down at the bottom more the definition of the article. Those individuals with a normal BMI, that is normal weight, have metabolic health that is very clear, and there is a reduced mortality. But on the other hand, right at the other end of the scale, we have obese individuals that have an altered metabolic status, and in these we see greater mortality. But the great surprise came in the intermediate stages, where what was seen was that individuals with a normal BMI but with metabolic alterations had mortality greater than that of obese individuals with a healthy metabolic status. So then health then resides on our metabolism and the evolution of our metabolism throughout time. But of course, when we talk about metabolism, there's quite a barrier that up to a short time ago was very difficult to go through. Let me introduce you all to the Metabolism Map. And this is only a satellite view, so to say. If we were to focus on each one of the points that you see, we encounter situations like this one, very busy. So to study the metabolic status of an individual is really quite a hard task. It's quite an adventure. In fact, if we go to the last or most recent versions of databases that encompass all the molecules circulating in our bodies, we find more than 16,000 that are endogenous, more than 1,500 that might come from drugs, but there are more than 22,000 that come from food. So the famous sentence of "we are what we eat" is very well reflected in our metabolism. Currently, we do have tools, very advanced technologies, such as the omic techniques, metabolomics. And metabolomics allows us not to analyze the whole of the metabolism, but we can analyze key elements with a relatively small sample of between 100 to 500 microliters. We can, in fact, analyze from dozens to hundreds, and in some cases, thousands of different molecules circulating through our bodies. And in this way, we can define the key processes of our metabolism, and in this way, see what our status is, what our metabolic status is. On the basis of this, then, well, we decided to go on to the Preventomics adventure, our project. And the name of it is Empowering Consumers to Prevent Diet-Related Diseases Through Omic Sciences. This is a European project financed by the European Community, and it's the participation of 10 research institutions, 5 small and medium enterprises, a standardization institution, a consumer organization, and also a patient organization. So this is a very well structured research project. What's the basis of Preventomics? We said it already. Health is determined by the status of our metabolism. However, throughout life, we know that external factors such as the use of drugs, environmental factors, pollution, but most especially diet and physical exercise, all this eventually determines the status of our metabolism, and in turn it causes a series of stresses. Here, well, we have them classified into 4 groups. Some Dutch scientists defined 4 fundamental stresses that can alter our metabolism. These are oxidative stress, metabolic stress, psychological stress, and inflammatory stress. When, of course, our body is used to everything and can respond pretty well to these four types of stresses. But when they go on in life and they become chronic, what happens is that there is a deregulation of the metabolism, and that induces or causes the emergence of disease. What we do in our research project in Preventomics is to determine the effect of these stresses in our metabolism. We will see it further on. And in this way, if we know the status of this metabolism, we can give nutritional recommendations adapted in order to fight against the very damaging effects of these stressful processes. But there are further key figures, not only metabolism, right? And not only molecular analysis of our physiology, there's more. We have the whole psychological aspect of nutrition. This is yet another layer that we add in our research project. There are a number of different studies that make it very clear that there is full consensus. More than 91%, in fact, of people believe that health, that emotional well-being and feeling well is much more than important. And I guess we all agree, don't we? So when you ask about personalized nutrition, people tend to see it as something mid or long term. In the next 10 years, the consumers say they will be more interested. You'll see it in applications, websites, meal distribution companies that might be able to offer products adapted to each person. And then finally, in a survey that was carried out by the Consumer Association, what you see here on the slide, the question was about the opinion of consumers on personalized nutrition and what aspects did they believe were more interesting about this personalized nutrition. Talking about the questions, they included genetic tests, which includes what I mentioned about metabolism. We also asked about assessment in supermarkets, digital health tools, psychological assessment, or food habit re-education. Which of these did consumers think were more important for personalized nutrition? And as you can see, among re-educating food habits and psychological habits, we see more than 65% adding up. So that is that the psychological factor, the behavioral factor, is considered as very important in personalized nutrition. So let's talk about these two axes. On the one hand, how do we analyze the metabolism? And on the other, how do we promote this behavioral change through personalized nutrition tools? So how and why does Preventomics work? To study the metabolism, what we do is focus on those stresses that we mentioned before. We analyze the metabolism of carbohydrates, sugars, lipids, that is the fatty metabolism, nitrogen as well, protein metabolism, and then oxidative stress, the alterations in the microbiota, and aspects that have to do with inflammation, systemic inflammation, metabolic inflammation. If we are able to study these factors and see in what way they are altered, we can give personalized recommendations to invert pathological situations. We also add other data. The genotype, that is the gene pool of every individual, the nutritional status, health status, physical activity, and the behavioral status. A series of tests are run on every person to see what his or her behavior is regarding food and regarding life in general. All this is then integrated in a system that different applications can access, mobile applications, websites, and so on, where they gather those personalized recommendations and they offer the consumer those dietary recommendations in different ways. I'll explain how in a minute. And on the basis of this, we have designed a series of interventional studies where we try to see what the effects are, the beneficial effects on the metabolism of this approach of personalized nutrition. And what were the first results of interventional studies with the voluntary subjects? Well, first of all, the person has to go into the Preventomics system. Then the person has an appointment with nutritionists and with nurses. The person is asked about his or her nutritional status, and samples are gathered to analyze the state of the metabolism of that person. Then we have all the necessary information for nutritional recommendations to be put forward, and access is gained through different platforms. I'll explain every example. And once this nutritional recommendation is achieved, we add behavioral change tools for the user or the consumer to be able to operate these changes in food habits in an easier manner. And last but not least, the person will be given a final report of the whole intervention. How do we apply Preventomics? How do we go about this idea? Well, first of all, with different clinical studies. First of all, in Denmark, with a company that gives home food. It has personalized menus that are elaborated on the basis of the Preventomics recommendations. Then we have a multi-center study between Southampton University and University in Krakow. And in this study, professional nutritionists are using a specific tool, a computer tool, that allows them to have access to the Preventomics information, and they can elaborate nutritional plans on the basis of the information they obtain about the metabolic status of a person. And finally, we, together with Aldi supermarkets, we have carried out a clinical study in Reus, in Spain, and the system is accessed through online shopping. So the user has a Preventomics support to elaborate the shopping list, and the consumer can see what are the best foods and what are the worst for his or her metabolic status. How have we designed this study in Reus with Aldi supermarkets to give you an idea? Well, we had the participation of 225 persons. They are voluntary people, and 180 started the study, and then some dropped out. This is typical. You always lose individuals, so that's why we have three groups. First of all, we have the control group. The control group has exactly the same tools as the others. It gains access to the same website for the shopping list, but the recommendations given are general recommendations based on the Mediterranean diet. It's not personalized recommendations. So then we take into account the placebo effect. Yes, I don't know whether you have ever participated as voluntary persons or subjects in research, in nutritional research, but when people participate, they tend to change their habits, yes, and that's how you have to rule out this interference. So that's why you have to have a control group. Then we have the second group of nutritional personalized nutrition. These people are given recommendations on the basis of their metabolic status. They can elaborate the shopping list on the basis of their metabolic status. And the third group that has the same, that is the recommendations on the basis of metabolic status, but furthermore, they keep getting messages sent that have to do with behavioral change. Okay, so these messages are small missions that these people have to actually comply with, and in a certain way it makes changing easier, changing their diet, because it makes them move away from their typical habits. Yes, these are very simple things sometimes. For example, tonight, dinner time, don't sit where you usually sit for supper, sit somewhere else. These are minor changes, but they start changing the links we have with bad habits, or at least the typical habits, yes, food habits. And that makes nutritional habits easier to change. So we have these three groups. We started precisely at the beginning of the pandemic, in fact. We continued throughout the pandemic. It has been extraordinarily difficult because, of course, I guess you understand that, users essentially have to log into a website and follow recommendations. But of course, behind this ease of use, you have analytics, gene pools, metabolic status, and so on. We were affected by the pandemic, by Brexit, by the crisis that has been in different supplies. It's made things very difficult, but at the end of the day, we have managed to complete our study with good results for the time being. And what we have seen is that, first of all groups, including control, increase compliance with the Mediterranean diet. That is, they adopt healthy habits. Yes, might be with personalized nutrition recommendations or without. But we have detected two groups that, as well as increasing these healthier habits, reduce BMI and body weight. And one of them reduces the waist perimeter. So, in fact, this was not a study focusing on obesity, rather on people in general, but we have seen that personalized nutrition tools have a very positive effect on body weight. And this means then that yes, something is working very well beyond the recommendations received by the control group. So we continued analyzing results, and we still are analyzing. Now we are going for the statistical analysis of biochemical results to assess effects at the metabolic level and see whether these personalized nutrition programs do have an effect as regards health of the individuals participating. So what we have then is a system, the Preventomics system, that can be applied in many different fields, from medicine, also biotechnology, biomedical research, and even analytical labs. And it uses new information and communication technologies. It's essential to communicate with consumers. Yeah, one has to have these new technologies, and the industry has, from foodstuffs companies that can personalize their products to supermarkets themselves that can in fact use this approach to give much more adequate recommendations to every individual consumer, even catering companies. These are the three cases of the industry that we have suggested as part of the study. Psychology, as I said to you already, has a fundamental weight in habit changes, especially when we talk about personalizing. And finally, we have nutrition itself. So, of course, this is a tool that nutritionists really like. It's very comfortable to use, very useful when you design the diets. And then also in the field of sports, it's easily applicable to anything that has to do with sports performance and prevention of lesions, slightly modifying the basics of the project. And up to here, what has to do with Preventomics. Thank you so much. Thank you. Thank you very much indeed, Dr. Delbas. Great. Please do sit down. I do have some questions. Do we have any questions coming from the audience as to what you heard? The way I see it, I guess it might surprise you. On the radio, we've talked about it many times. I mean, of course, we, as partners of Preventomics, there's one first question of EURECAT. By the way, EURECAT is one of the most important technological centers in Europe, and we have this center in Reus, here in Catalonia. Let me get my mask off to speak clearly. Anyway, so the question was EURECAT. So where does it fit in Preventomics? And they told me omics, because this has to do with omics, yeah? And we could talk for a long, long time about this. We could even organize another program only to talk about this. But the question is now for you, Doctor. EURECAT, this very high-level technological center, why did it decide to become involved in a project like this one? Okay, lovely. Yes, can you hear me better? Yes, much. Thank you. Well, let me repeat then. Why did EURECAT, this technological center, become involved in the Preventomics project? Well, truth be told, we decided to coordinate a personalized nutrition project because it is one of the key fields in biotechnology. It is one of the trends, precisely, because one has to go towards the solution that can be applicable to all, yes, but it should be personalized, and it fit in very well with nutrition and health, which is what we work on. It combined very well with all the other omic sciences. It has to do with getting to know better what goes on inside us and how does all this affect our organism, what do we eat, metabolic routes, and then it had a very interesting and important digital component. So it linked up different research areas of what we do. And as a mission, yes, as a technological center, we also want to generate and transfer knowledge, give it back to society, generate impact, not only economic impact, but social impact. And I guess as well, Dr. Del Bas, that there's a challenge as well, yes? Yeah, when we saw the network of the metabolism, and when you mentioned this satellite view and what we talk about, this personalized new incredible challenge. Totally, when we started thinking about it, yeah, when we were beginning with the idea, we thought, listen, this is passionately interesting, and we decided to go for it, yeah? And then one has to see whether um, I don't know whether it's going to be a spoiler, but I've been told that we'll have this for summer. Is it nearly completed? Listen, in fact, the project will be completed in a couple of months in April. Right now, we are retouching and finishing all the studies. Out of the 4, we have 3 completed. 1 is on the brink. And well, we are, yes, connecting with what we said at the beginning, data analysis to give value to the results and be able to transfer the results, of course. I mean, as Josep was saying, how Preventomics can be put into practice. Yes, because of course, from the moment you end this, you have to put it into practice. That's a process. Let's see how long that takes. Mr. Vaquero, you have the microphone. Please go ahead. Congratulations, first of all. And yes, I do think this is an initiative that's going to be really enriching. Can't you hear me? Not really. Well, the mask makes it more difficult. Yes, I'm saying congratulations. First of all, I do think this is an initiative that's going to be shedding more light on nutrition, or an interesting aspect of nutrition. And what I understood as well is that obviously it depends on the nutritional needs of each person according to his or her metabolism. And this depends as well on the environment and the situation of that person in that given moment. So my question is, up to what point the nutritional plan that Preventomics will give is dynamic? Because of course, I think I understood that patients at the beginning would give samples. I guess you get all your measurements from there, but the situation and the environment of every person can change. So then your Preventomics tool, up to what point is it dynamic and can it adapt? Well, I'm telling you now, thinking of the future. For the time being, what we can do now is assess the metabolic status every so often, yes, to fine tune and modify nutritional recommendations. But thinking beyond and thinking about all the technologies that are being developed right now in biosensors, for example, to be able to connect a system like this with a certain type of biosensors that can give us real-time information as to different aspects of our metabolism might be incredible, and that might make it dynamic, and it might make it possible to adapt fully to the environment and to any changes that might occur in the life of this person. Dr. Ruges, yes, first of all, congratulations for the presentation. Thank you. Dr. Josep Maria del Bas and Dr. Gutiérrez, for us it's such an honor to participate with you. And listen, in my case as a patient, yeah, what I like, well, many things of the project. First of all, the project per se is very interesting because at the end of the day, with all this, we're going to, yes, sorry, I'm going to take my mask off. So what we're going to be achieving is very possibly the prevention of a number of diseases, many, and some affect osteoporosis and arthrosis. I mean, obesity, diabetes, and metabolic syndrome, high blood pressure. Precisely, I'm participating in a panel that has to do with cardiovascular technology. So all this is so interesting. It can really change. I mean, we can work on prevention, and we know that when we have good prevention, we're saving so much on future drugs and medicines. So, of course, when you start a project, you have some questions you expect, and then others appear. So I guess there'll be a second stage of Preventomics, right? I mean, according to what pops up. That on the one hand. But listen, this is fantastic, great. Then what I also value is that patients participated, yeah? In your research. There are very few projects in which patients are involved from the beginning and in which patients receive the explanations of every step of the process. It's incredible. I mean, usually it's difficult. We have so many patients, and it's not always easy to get patients to collaborate. But there's the radio here that makes it more dynamic, and they listen to it all because usually patients get it given at the end, and it's here you are, fit in how you can. So my congratulations, because really you've involved people right from the beginning. We have learned so much. So I mean, it's great, great, and it's not frequent. I'm saying it because yesterday, for example, we had half of the audience was physicians and half patients. That's not frequent, but it's the way it should be. And it's very good. A research process that right from the beginning involves patients is great. This is a 2020 Brussels initiative, really, yeah, that you get the patients involved from the moment of entry. Because what happens often is that information it doesn't only not get to patients, it doesn't even get to the health professionals, yeah. I mean, we as physicians sometimes don't get the full information, or at least it's very biased. Well, just imagine the patients, yes? So great. My congratulations, and thank you for sharing with us. Dr. Vergés, I remember in the first patient conference 6 years ago, because now we're getting to the sixth edition, there was a round panel mentioning that the patient had to be at the center of everything and at the beginning of any research process of whatever has to do with a person's health. It has to be like this, doctor, doesn't it? Because the aim is the person, the patient. Yes, if you allow me, first of all, 100% thank you for your collaboration, your active participation and involvement. And yes, indeed, the project wants to meet these very important challenges in society. And if you want this to happen, you have to count with patients right from the beginning, and then also public private partnership. These have to be solutions that work. So yes, it means to transfer knowledge in value. Yes, if you allow me, yes, now my microphone is working. Would you like to say something about the Mediterranean diet, which you mentioned? And it's something, I mean, people believe that they're following a Mediterranean diet, and it's not true. Or will you do this another day? But beware. I would like Spanish politicians to talk about Mediterranean diet. Please do. We have the best diet in the world, really healthy. I mean, the Mediterranean diet is not put into practice in our country. It is being lost. There's this terrible influence of foreign diet. I'm sorry, I have to say it, but Mediterranean diet is the healthiest in the world. And we can, talk about virgin olive oil in New England, 30% reduction of stroke, and then fruit nuts as well, how healthy they are, a regular consumption of nuts. So the Mediterranean diet, we have to really, call for it to be used and put into practice and get politicians to say this. Do you agree? Completely. And it's one of the dietary patterns that has more scientific evidence as to its benefits in many, many different aspects. Definitely. We took it in our project as the diet of reference, yes, the yardstick on the basis of which we try to adapt nutritional recommendations. Do remember we're talking about personalized diet. Yes, it's from person to person. So as we are here in the Spanish Olympic Committee, I would like to ask, how do we take Preventomics to sport? Because every athlete is different. But of course, it's not the same to be a swimmer or to be, I don't know, a marathon runner, a basketball player. Then, I don't know, the goalkeeper in football is different from midfielders. So, how are you going to take Preventomics to this? Well, when we designed the project, we were looking for a solution that had to go across, right? And as my colleague has said, there's the population in general, but I mean, and then you also have obese persons. Adapting to sport, yes, you would have to adjust this recommendation system that works so well with the different biomarkers, adapted to the specific traits and conditions required for some type of athlete, type of sport, even type of pathology that some athletes suffer more than others. We would have to identify all this first and adapt it. Indeed. Because then, yes, we would be able to give those recommendations really in a tailor made fashion. Yes, of course. It's been said, I mean, we have these omic technologies. It's the advantage of them. As long as we have biomarkers and molecules that we can analyze, we can adapt the system to any system. It's the advantage, the modularity. So indeed, we can eventually get to know molecules of the organism that change in different situations and for different types of athletes, analyze status, evolution, and performance. So even the energy output, yes, of the athlete when the day of the competition is coming close, on the day of the competition itself, after that day, all that can be monitored. Well, yes, the more knowledge advances about sport and metabolism and the relationship, because of these technologies that we have available, we can use them to analyze all this. It's spectacular, really. Yes, that's the word, spectacular. Yeah, my dream really is that somebody knocks on the door of my home and somebody bring food to me. But the food I would have to eat, yes, the Preventomics recommended food, both for, breakfast, lunch, and dinner. I saw the name of a supermarket that you mentioned, yeah? Is this the way things go, that we will be able to go to the shelf of a supermarket and pick certain products, but that then will be eventually delivered home? Or as we see in different social networks, well, a number of brands that make it their business to bring pre-cooked dishes to your home. Is this the best implementation regarding the potential general audience so that you work Preventomics well? That campaign of Preventomics is ringing or knocking on your door. Well, yes, this is the way we conceived it, really. I mean, the study that we're carrying out with Aldi supermarkets, yes, what Aldi does is have a catalog so that users can define their shopping lists on the basis of the recommendations, yeah? So, yes, in this sense, it's very similar to online shopping. You go to the catalog, you look, you see what's best for you, you see other products, and what the user does is choose the products, and then on the shopping list, the person is told whether that product that he or she chose is good or not for their metabolic profile, and there they have the option of maintaining the product or deleting it. Yeah, and the next step is to get the pre-cooked food, right? Because many of the companies that are active now could be fantastic partners, right? I don't know whether I'm giving you any ideas. Yes, in fact, one of the companies, of these business models we mentioned had to do with personalized home delivery food. And yes, indeed, there was a first layer of personalization. For example, main groups, I don't know, people that cannot have any milk, for example, and so on. But then we went beyond and we truly analyzed, and then we went into detail. This has to do with technology, omic technology, markers and the ability of these biomarkers. I mean, some of them are used in clinical routine practice. Yeah, I mean, any analysis that you get, any test already includes these biomarkers, but we should use other more specific biomarkers. Yes, we should make headway there. This will take some time, but I insist the challenge is fascinating. Yeah, well, omic science gets everywhere. But listen, what about wastewater as well? Yes, that's also an application. They know whether COVID is increasing or not, and there are, consumption of certain substances, legal or not. We're also analyzing this in EURECAT. Beware, yes, wastewater. Yes, absolutely. Any more questions from the audience? Do we have any pressing question? Well, if that's not the case, thank you very much to our two experts. A big hand, and go ahead, go for it, Preventomics. Thank you very much indeed. Such a pleasure. Goodbye. Thank you.